talk to you about the social determinants of health. And I really wanted to start out this presentation by talking about myself and introducing myself and giving you some information about how I have had personal experience navigating the healthcare system and all the systems in place within this Bay Area community during one of my health crises. So I hope you'll bear with me just for a moment while I give you a little bit of my story, and then we will get into the trenches, so to speak. Okay, so I wanted to share some photos with you. Hold on, I'm gonna move you guys down here over my notes. So I am originally from New Jersey. I'm a Jersey girl, born and raised, and I'm the only child of two loving parents. And I went to school in Seton Hall University in South Orange, New Jersey. I have my bachelor's of science in nursing degree from there. I've been a nurse for 26 years. So I have had a lot of experience throughout the country as a nurse and as a nurse administrator. I went to the University of Pennsylvania for my degree in healthcare management and nursing administration. So I've seen healthcare from the patient care side, the direct patient care side, as well as from the systems side, looking at more of a global vision. So I have a lot of experience and a different perspective than maybe the average person. I came to California in 2003 as a travel nurse. I wanted to see what California looked like. I didn't know if it was like what I saw on TV, Baywatch and Melrose Place, but I wanted to see if what I thought was true, and it wasn't, but I loved it just the same. And I've been here for since then. I never left after I came in 2003. And I've been in the Bay Area since 2006. So the picture on the left is a picture of my husband and I. We got married. We're both second marriage, remarried in June of 2019. And this is that December. So we had been married for about 6 months, celebrating New Year's Eve. It was at this time, and maybe it doesn't look like it in a picture, but at this time, I knew something was wrong with my body. And I had communicated that to my healthcare professionals that are responsible for my primary care. And I was having a lot of heart palpitations. My blood pressure was up for really no reason. I felt like I had a weight on my chest. I could feel my heart beat in my neck. In the middle of the night, I would be awakened with this sense of pressure on my chest and in my neck. And I am a well-experienced. I know how to articulate what I'm experiencing in my body. I feel like I have credibility with my healthcare provider. And despite all of that, despite knowing the system, despite being able to really explain what I was experiencing, I felt like some of my current concerns were dismissed. They basically said, this sounds like anxiety, and we're going to put you on some anxiety medication. And I knew that that was not it. So after this wonderful celebratory night in San Jose with my husband and my family, 5 days later, I was at church and I collapsed in the lobby of the church. Now, I will tell you that my outcome has been tremendous, considering what could have been for me. And I believe that what I experienced was a miraculous series of events. The first two people to respond to me at the church were two friends of mine. One was a neurologist, and the other one was a emergency room nurse. And they immediately recognized that I was having a stroke. They called the ambulance. I was at the hospital within 35 minutes of collapsing. And I arrived there and the ambulance doors opened, and the ER attending physician for that day was my very best friend, who I had just traveled Europe with 7 months prior. And she said to me, "Really, this is what you do to come see me? We could have had wine in the backyard." Uh, and I immediately got assessed. It was a level 1 stroke center. I got medication to dissolve the clots in my brain, and they thought everything was going to be great. Most of my function came back. The middle picture is me in the ICU 2 days later. I was in the ICU for about 9 days as they did their exploration of trying to figure out why I had this stroke. My face came back, my speech came back, but as you can see from the head tilt, I'm not being cute, the right side of my body was still turned off. And the last picture is me at my last day at the inpatient rehab facility, where they had gotten me to the point where I could stand independently, but I still needed a walker or a walking stick to walk, and the rest of my therapy continued at home. So this was a truly catastrophic event for my life. You know, I was 6 months into my new marriage. I have 2 young children. They're now ages 9 and 11. And this was unexpected, to say the least. It shook my world. We're going to see how my experience is different because of the resources that I have. You know, I have networks, I have people, I have education, I have information. I know how to navigate the healthcare system. I have insurance. At the time, I actually had 2 full insurance coverage benefits from 2 different employers. So I was overly insured. This whole series of events for me, including rehab and 2 subsequent surgeries that I needed, cost close to $1.8 million. And that is still counting, because I'm going to start therapy again next week for some continued weakness that I'm having. So healthcare in America is quite expensive. So when we look at social determinants of health, what we're really talking about are what are the things that are out of people's control that impact their level of health, their quality of life, and the outcomes that they will experience. Most of these things we are born into, and we may or may not be able to change the level of our lifestyle or the level of our access throughout our lifetime without serious support. So the CDC looks at these 5 areas. They've identified these 5 areas as the key areas to why we have such marked health disparities in the United States. So we're looking at economic stability, education of the persons or the population, health and healthcare, neighborhood and built environment, and social and community context. And these are the confines of which I'm going to talk about today. And throughout this presentation, you'll see that as we look at each of these areas, many are things that the average person would not know how to navigate their way out of. And that it really requires tremendous social support, a rewriting of laws, creating of programs, and an outreach of public health to change the lives of the people around us. As Alice mentioned, the people that are marginalized, that are under-resourced. So that is our goal, and that's what we're going to be talking about today. When you invited me to come, when Promise Zone invited me to come speak, I was overwhelmed because this topic is so broad. It is so broad, and you could get a whole degree in this, a doctorate even, looking at all the complex systems that feed into these issues, and the American culture and how it propagates all these sustained deficits within the communities and neighborhoods, particularly in our cities and also in our rural areas. Go to this next one. So when we talk about economic instability, what we're really looking at is a set of areas. I'm going to focus on only 2, but this is not again, the full context of where the problems lie. So what I'm looking at is the impact of poverty and the impact of food insecurity. So right now in the United States, 1 in 10 people lives in poverty. 1 in 10. Now there's over 300 million people in the United States, so that's a huge number. In 2018, 11.8% of the population was living below the poverty threshold. That's, again, a staggering number. So we have approximately 43 million Americans living in poverty. And when you have a household of people that have lack of resources, lack of access, you're going to see a higher risk of mental illness, particularly anxiety and depression, chronic disease, which can be anything from heart disease, diabetes, obesity, and an overall lower life expectancy. Again, things that you're not choosing for your life, but situations that you're born into. Minorities living in poverty have even more adverse effects, particularly Black Americans, Hispanic Americans, and Native Americans. Those 3 areas, you will see that the health disparities overall are even higher for these 3 groups. So impoverished communities are less likely to have healthcare. They're less likely to have healthy food, stable housing, and opportunities for safe physical activity. 22% of children aged 17 and younger were living in households where there was no adult working full-time year-round. 22% of children under the age of 17 do not have a household where either parent or either guardian is working full-time. So when you have those kinds of statistics, you can see that this is a really, really crucial part of making sure that people have healthy outcomes, healthy lives, a good quality of life, particularly the most vulnerable, which would be children and our seniors, and of course, those that are disabled. When we look at food insecurity, this results from the lack of money or access to get healthy, fresh food. I've often had conversations with my students, even before I worked in the RN to BSN program. I taught in the accelerated bachelor's in nursing program, and those students didn't have any experience in healthcare at all. So it was new for them. And I said, one of the ways that we let people down the most in healthcare is when we see people coming into the system over and over again, they're not thriving, they're not doing well, they're coming back, let's say for diabetes, and we send them home and we give them nutritional education, we give them the medication that they're supposed to take, we teach them how to take the medication, we do all these things, and then they come back 2 or 3 weeks later with their blood sugar out of control and all of their body systems stressed because they're not taking care of themselves, and we label them as being non-compliant. And to me, that's the biggest slap in the face, because you can make a plan for somebody, but if that plan is out of reach or unattainable, then it's not a plan worthy of that person. And to call them non-compliant really doesn't look at what system, what environment we sent them home to, and whether we set them up for success. And so really that's our failure as a healthcare system, as a community system, as a government structure. We are failing people. And so it's really important to note that having access to food is so important. It is the building blocks, the foundational thing that we need to be healthy. There are urban and rural and low-income neighborhoods that are lacking in full-service supermarkets. Some people are doing all their shopping at the Dollar Tree or at a corner store, or at maybe they might have access to a farmer's market, but those are usually not in urban settings and oftentimes are far to get to. So what we really need is to have some infrastructure for these communities. In 2018, 11% of American households were food insecure. So food insecurity is difficult. It's defined as the lack of consistent access to have enough food for every person in the household to live an active, healthy life. And some of the objectives that the Healthy People 2030 initiative, which is created by the Department of Health and Human Services, when they talk about Healthy People 2030 and they look at food insecurity, what they're trying to increase, especially in children, is the increase of calcium consumption, the increase of eating dark leafy green vegetables, red and orange vegetables, and beans. So these categories are areas where you're going to get the best nutritional bang for your buck, so to speak. And so those are the areas that they're focusing on, because children that are hungry, children that are vitamin and nutrient deficient, have mental health issues, they have behavioral problems, and they often are not doing well in school. So it's so, so important to make sure that people have access to food. From my personal perspective, in New Jersey, some of you may be familiar with the city of Camden, New Jersey. Camden, New Jersey is like any typical urban area where there is an economic depression, lack of jobs, lack of access. And Camden, 20 years ago, I attended a conference in Philadelphia where public health officials were presenting, and they were on a panel. And they gave some staggering statistics, many of which have not gotten better or are even worse. At that time, 65% of the population of Camden, New Jersey was under the age of 17. So we're literally talking about a city of children, right? So when only 40% of the population or 35% of the population is even capable of working, and those persons are incarcerated, undereducated, lack of education, or the schools are underperforming, it's very difficult to be able to have any economic growth. Today, August 13th, 2021, there is no full service supermarket in the city of Camden, New Jersey. Not one. The last one closed down several years ago, and it was never replaced with anything. So there's really such a difficulty to be able to, especially if you don't have transportation, to access food. To access food by public transportation may take 2 hours, 2.5 hours round trip for one person. That is not sustainable for any community. When we look at education, this is what I call diving into a very deep rabbit hole, because we could spend all week talking about education. We know that America has an education problem. More specifically, it has an education equity problem. We still have underperforming schools. We still have teacher shortages. We have schools that are not safe. The physical structure of the buildings are not safe or healthy for children to attend. There's crime and violence in many schools. We've had multiple school shootings. And so children are experiencing not only trauma from their communities, but at times there's trauma that they're witnessing in their own school setting. And so the impact of education really is a lifelong impact, because if we don't grab children in the beginning and get them to perform at or above grade level, we really have lost an entire generation. So when Healthy People looks at the impact of education, they're looking at 4 main areas that the statistics support. That if you can get people to graduate high school and have that be the minimum level of education, then you have better outcomes. Language barriers continue to be an issue within America, because people don't always have access to the amount of information that they need to make good choices for themselves. Early childhood education, we've seen so many programs being cut or closed for the first 5 years of life. when we know that preschool education, early childhood intervention is key and vital to the rest of that child's life. And certainly the exposure of the opportunity for higher education, which I'm very hopeful that we will be able to get at least education at the 2-year degree level free for every American, because that would be so key to give access to people to have a trade or to have an entry-level education to get into the workforce and make a livable wage. So currently, we know that not having a high school diploma leads to lower wages, limited job opportunity, and an increase in poverty, right? So they go lock in step. High school dropouts can experience poor health, lower life expectancy, and chronic illness. And we know this to be true because the statistics bear it. The goals are to increase math and language proficiency by 8th grade, right? And so that's really the cutoff. We have the opportunity to capture children before they hit high school and make sure that they're at grade level by 8th grade. When they are not, the high school rate dropout is very, very high, okay? One of the areas that many communities, many states are looking at, I know the state of California has passed some legislation and developed some groups at the legislative level, looking at the impact of trauma on children and the impact of trauma on their mental health, their physical health, and their ability to perform in school. And so this is important because it hasn't been an area that is well defined. And even when you look in the data within our government, it's all in the developmental phase. They're just starting to collate data about the impacts of trauma on children, on their behavior, on their ability to learn, and even the changes within their brain specifically. So there is so much area of growth that we need to do in the education system. There's so much opportunity for us to capture people when they're young before they get to a point where they're no longer as easy to influence. We know that childhood obesity is a huge issue. And that nutritional education can only go so far if that child is living in a home where healthy foods are not available. So as I said before, all these things go lock in step for the healthy outcomes of a population. So here's my area and Alice's area of expertise. We are entrenched in health and healthcare. And so far as we've talked about these domains that the Health and Human Services and the CDC looks at, if you look at my story, I had all of those things, right? I had a high level of education. I had economic stability. And when we look at healthcare, I was overinsured, right? I had a primary care physician that could coordinate my care. And I have a good understanding of health information and the healthcare system so that I know how to navigate it pretty well all by myself. So when you look at me, you can see that these things, when they are in place, they work, right? And so what we need is to identify these populations that are not having access to the things that many of us take for granted. So when we're looking at health and healthcare, we're looking at access. We're looking at access to primary care and health literacy. I'm just going to visit this very briefly because I want to leave a lot of time for everyone to answer questions. So the health services, health access is defined as the timely use of personal health services to achieve the best outcomes. Right now, many Americans, because they have limited access, they are not accessing healthcare until it's time to go to the emergency room. Typically, when the disease process or the acute process of illness is well advanced and it's often too late. We have very little success in some communities with prevention and primary care. Primary care is when a patient is provided a broad spectrum of preventive care and curative care over a period of time. So these are our family doctors, our nurse practitioners and physician assistants, our clinics, our people that when you walk in, they say, "Hi, how are you doing? How's it been? How are your children?" These are people, these are offices and clinicians that know you, know your story, and there's a relationship that exists. And people can see you with a full story. They can see your full life and understand all the issues that you're facing. That's what many Americans that are under-resourced are experiencing. They're missing this piece of somebody that can coordinate the care, their health care for them throughout their lives, from the time of birth to the time of death, which we would hope would be a long and full life. So the things that impact here would be lack of health insurance. And of course, we know that this has been an issue of conversation at even the federal level for at least 30 years of how do we get access of health insurance to everyone that is in the United States. Minorities account for more than half of the uninsured population. So that's a huge number. 1 in 10 people in the United States do not have health insurance. Again, we're talking 30 to 40 million people that have absolutely none. And for those that do have some, it is not as robust as it should be. It's basic emergent care, and there's very little opportunity for preventive and primary care that doesn't have a very high copay to accompany it. We're also looking at lack of transportation. Again, I talked about the access to healthy foods and not having transportation to get there. I had a patient before who was pregnant with her 7th child, and she did not get any prenatal care. And on the patient's chart was patient is non-compliant with prenatal care visits and prenatal care testing. So when I met with the patient and I said, you haven't been in since you found out you were pregnant, we really need to test you to make sure that you don't have diabetes of pregnancy or any of these other things. We want to check your blood pressure. Why haven't you been coming? And she said, our family van broke down months ago. We have no money to fix it. And my 3 of my children aren't old enough to be in school yet. And it's hard to get all of us on a bus that takes an hour, maybe 2 hours to get here with the children in tow. And I thought, well, this is the opposite of non-compliance. This is being set up to fail. So lack of transportation is huge because it's not only missed appointments, it's the inability to get your prescriptions, or it's postponing care that you know you need because you don't have the ability to get there. Certainly in California, we're experiencing physician shortages, and this is being seen across the country, particularly in primary care. So there's a lot of specialists in some areas. Not all specialties have an abundance, but specialties are doing okay. But primary care has some significant shortages in every state in the country. And for those providers that are here, many of them don't necessarily want to take Medi-Cal or Medicaid because they don't get as much reimbursement for those patients as they would for someone who has a private insurance or is private pay. In terms of health literacy, the main thing I want to say about this is the ability to have access to information in your language is still a barrier at most doctor's offices, at most hospitals. It's a barrier unless you go to a provider who looks like you And we do not have a lot of diversity with providers that are Spanish speaking, that are Latino, that come from that culture. We do not have a lot of providers that are Black American, Haitian American, Caribbean American, or from the continent of Africa or African countries. We don't have good representation of those groups. And so oftentimes people are seeing a provider that's outside of their cultural experience, outside of their first language, and that immediately creates a barrier and can create adverse health outcomes because they don't have the full information to make the best decisions for themselves. And we've already talked a little bit about primary care and all the obstacles that present there. I read a very interesting statistic and I want to share it before it. So I'm going to read it so I can be precise. In 2015, only 8% of adults aged 35 and older received all of the recommended high priority preventive care services. So we're talking about an annual physical, regular blood work, dental care. We're just talking basic primary care. Only 8% of Americans accessed that around 2015 to 2017. So we're seeing that even when people do have insurance, because of the copays, because of the fear that something might be wrong that will lead to more and more expense, people are avoiding care. So we really need to change the dynamic so that people not only have access to care, but they have the ability to understand the importance of prevention so that we don't get to the point of chronic illness. Julius, how am I doing on time?
We are over time due to the technical difficulties. And so we definitely have folks who have stayed to finish your presentation. So, please continue, but, if you can be as brief as possible, that would be helpful.
I'm going to breeze through these because these are a little bit easier. So neighborhood and built environment, you can read what I've written here, that these are all the things that experience this. My husband is from Flint, Michigan. So the Flint water crisis was a huge impact because all of his family still lives in Flint. His mother passed away just a couple of years ago of pancreatic cancer that came out of nowhere. She was a healthy woman. And many people are coming up with cancers, pediatric cancers, and are having a high mortality rate as a result of it. So we know that neighborhoods and the built environment is one of the biggest parts of this puzzle. I read an article last week in the San Jose Inside publication, and it talked about the renewed interest in closing the Reed Hillview Airport that's in South San Jose. They did a study from 2011 to 2020, and the results were just published, that they collected 17,000 blood samples from children under the age of 18. And it was found that the children surrounding this area of the airport all had significantly high levels of lead in their blood, significantly high. And it's because of the type of aircraft, and the leaded fuel that they use for these single piston aircrafts that are taking off day in and day out. There are 21 schools and childcare facilities in the immediate vicinity surrounding this airport. So the impact of that, through no fault or control of the community, is tremendous. And so now there's this big outcry. It's supposed to be closed in 2032, but it has not been shut down, or the traffic has not been decreased at this time. So there's really this renewed effort to get it closed even sooner, or to switch to a completely unleaded fuel environment. So we know that housing and the exposure of toxins and contaminants, clean water, clean air are vitally important. And then the last area is social and community considerations. Social cohesion and capital are really important because that's about your relationships and your network. You know, that was, you know, Miss Gladys on the street that would make sure that all the kids were playing nicely, or that she'd call your mom. That social capital is, you know, do you have any jobs for me? Do you have any work? Do you know where I can access this? There are people that are giving you referrals and references. The topic of discrimination is just too broad to talk here, but I do want to mention that the cumulative stress that people are experiencing, particularly as we've had recent racial and social unrest, we've had a very volatile political environment. It is definitely having a negative impact on the health of people. It certainly was having a negative impact on my health as I approached my medical crisis. And so it cannot be dismissed that certainly discrimination as well as bias within the systems that that people are experiencing has a huge part to play. But one of the most areas that I found shocking was this area of incarceration and the impact that it's having on families. 5.2 million Americans are currently barred from voting. So when we talk about civic action and involvement, there's a whole population of people that have not been, and that is disproportionately Black and Hispanic citizens. Formerly incarcerated people have difficulty securing work, housing, healthcare. All of those things pour into housing instability, poverty, food instability. And so when you have that, it's important to make sure that we understand that we need to do more to bring people back into the community once they've been incarcerated, more programs, more outreach, so that there is an ability to capture this population of people, because when you do, you help the entire family. Just some brief statistics on COVID, because COVID has really revealed the cracks in our system in terms of health disparities. And there's been a lot of discussion. These statistics, let me go back. Even though some of these groups, Hispanics, Native Americans, Black Americans, are a very small proportion of the US population, they are a much larger proportion of the percentage of cases that are contracting COVID compared to our white American counterparts, who are the majority of the population, but still not seeing that same level of rate of infection. And the deaths per 100,000 shows the true disparity, that even though we're contracting the disease at the virus at a higher rate, we're dying at a disproportionately higher rate than our white American counterparts. And so when we are looking at this data, this is really what is showing that there are chronic illnesses and there's a disparity in the overall health of the population within our minority populations. I'm going to have some links available within the presentation bio when it's posted on the Facebook site and the Promise Zone site. There's a lot of information out there. I put these three here, which is the CDC's Social Determinants of Health and the CDC's COVID, which is being updated very frequently. But Healthy People 2030 is giving us a lot of good information. Some of these initiatives have been on the Healthy People list for 30 years. And so we're not making the gains that we would hope to make to improve the lives of people. So I'm hoping that organizations like Promise Zone and professionals like all of you will be a continued part of the solution as we figure out how to improve the lives and the outcomes of every American equally. Thank you so much for taking the time to listen.
All right, thank you so much, Myika. I know that I said please remain on mute, but if you want to unmute yourself and throw some claps or some cheers or some thank yous, I would not be opposed to that. That was such a wonderful presentation. Mike, if you care to, you can stop sharing screen. You know, Myika spoke amazingly about the social determinants of health. Since before the inception of the Promise Zone, it was aligned with the social determinants of health, and the focus of it is to, across all sectors, and be the catalyst and the host and the facilitator of collaborative efforts among federal agencies and both local, public and private leaders to improve outcomes in the most distressed areas and the most underserved areas of Sacramento. And we are not alone. We are one of 22 Promise Zones, and we have created a national coalition of Promise Zones. And we will be having a federal convening. It's called the National Coalition of Promise Zones 2021 Federal Convening. It will take place during the week of September 20th. It will open up with an opening session. We'll have our representatives from HUD and also from USDA headquarters. We'll do an overview of the sessions for the rest of the week. During the following days, Tuesday through Friday, there will be 2 sessions per day, and it will be federal agencies and change agents sharing resources and opportunities that will impact areas like Promise Zones, and they'll be given examples of how those resources have helped create change in those areas. And so we really want you to be a part of it. One of the special announcements that I want to give you too is that Jeffrey Canada, who is the visionary of the Harlem Children's Zone. If you don't know about that, please, I encourage you to look it up. I could share information about it. You can reach out to me. But he started out with a couple of blocks in Harlem, and now it's about 97 blocks, and he's doing a whole community change, focus on improving outcomes for both the students in education and the parents, and all the kind of social determinant focus areas. The Promise Zones were created off the Harlem Children's Zone model, and he is going to be presenting during the federal convening on our September 21st session, the second session of that day. It'll take place at 11:30 a.m. to 1 p.m. Pacific time. So please go in. I put it in the chat. You can go in and save the date, kind of similar to you did for this session. You go into Zoom, you register, and you can create a calendar invite. So I encourage you to do that. And so I'll stop now because I'm all excited about social determinants of health, but more importantly, combating the negative outcomes in regards to social determinants of health. So I want to stop now and see if anyone has any questions for Myika. You can throw them in the chat. I'll relay them to her so that we can reduce background noise and et cetera. So please, any questions anyone may have? Don't be shy. So will the convening be a virtual event? Great question, Shannon. I'm sorry, I did speak towards that. It is absolutely a virtual event. It'll be a series of 8 sessions. And like I said, Tuesday, Wednesday, Thursday, and Friday of the week of September 20th, there will be a morning session 1 and session 2, and all of them will be virtually. And you register for them a la carte. There'll be a wide range of topics covered. It'll include HUD, Health and Human Services, USDA, EDA. We've invited the White House. We'll have several different departments, office and bureaus and councils from the White House, and so much more. So a question for Myika: are there are discussions about using different labels for non-compliant patients, especially those that are non-compliant due to barriers such as lack of transportation.
Absolutely. I think that that is more of just a bad habit now. I think healthcare professionals are certainly more aware. Uh, there's a desire and a goal to look more at the social determinants of health, health disparities, healthcare bias, even at in the college level for nursing programs, particularly, certainly in case management and social work, and it's growing in medical school programs. What we do in the hospitals now, and we've been doing it probably for about 15, 20 years, is doing plans of care that are personalized to the patient. So there will be parts of a care plan that are, say, if you're having a heart attack, they're the same for everybody. We know that those are the evidence-based steps that you need to take to make sure that people survive and then recover from that health process or that disease. But what we also would include is referrals to social work if that person didn't have a home to go back to or a safe place to go back to, physical therapy or cardiac physical therapy if that patient had multiple stairs in their home. So we're looking more at the discussion of how we can do things better. I know that at Sequoia, is it Sequoia Hospital, Sequoia Medical Center? It's what support. I think it's Sequoia Medical Center. I worked at Meals on Wheels doing community health in San Mateo, and the Sequoia Medical Center had created a plan for people that were discharged from the hospital that met a certain requirement, particularly the frail, elderly, and other vulnerable populations, and they automatically got enrolled with Meals on Wheels once they were discharged. And they saw a 60% decrease in the readmitting rate for those persons that were going home after having surgery because they had access to food and they were able to heal. And it saved them millions of dollars. So we know that these programs and thinking out of the box works. It's just taking someone having the initiative to look at the research, look at the data, and introduce new ideas, new concepts to help us to look beyond the hospital walls and see people in the environment that they're at.
All right, great question, Shannon. We have another amazing question from Melanie. Based on your personal experience, how do you recommend improving your advocacy for your health issues when you feel that you are not being heard by your providers? And the second part of that question is, or how do you help others advocate for themselves?
This is a huge issue because I still experience barriers all the time. I actually had a doctor in Walnut Creek. My blood pressure was out of control at another time in my life for another reason. And he told me that unfortunately I was just a Black woman in my 30s. That was his diagnosis. I was passing out randomly in the street. My blood pressure was so high. And then it would go back to normal. And I said, this is the craziest thing. And he says, well, sometimes it just happens. Sometimes Black women in their 30s, this is just what happens. And I thought, I don't just see randomly Black women just dropping down in the middle of the street, or in the supermarket. So it's those kind of mindsets where you really have to push back. I had to get a new provider. And I tell people, don't be afraid of asking around and saying, do you like your doctor? That's how I find my doctor. I want to know, do you like your doctor? I go online and look up the rating for that physician, or I'll go to a new clinic, and I've had tremendous success with nurse practitioners. I think they spend more time with you. They get more information. They're more dialed into me as a whole person. So I would say that's the first level of advocacy, is aligning yourself with the right practitioner. And the second thing is when you don't when you're not comfortable with what you've received as the answer or the plan of care, you go somewhere else. You go somewhere else. Because it's or push back and say, I don't think you're taking me seriously, because sometimes people are not well intended, more as they're rushed or just ignorant to what is transpiring in the relationship. And so sometimes even calling people out is helpful. But I'm at the place now where I have decided I have to be more active in my health. And that is, and Alice can attest to this, because I didn't know much about mind body, mindfulness-based stress reduction. I didn't take into consideration the impact of stress on my sleep, and the importance of eating throughout the day, or exercising, because I was able to, for me, exercising was about what size jeans I was wearing. Right. So it's more than that. And I'm learning now what I wasn't taught as a young person was that as you get older, you have to take different care of yourself. So encouraging people to take their health into their own hands, getting good nutrition, getting good sleep is so critical. Exercising, moving your body. In my promo videos, I showed my dog Kobe, because he was a huge part of me rehabilitating to being able to walk independently. They didn't want me to walk by myself. And I said, I'm not by myself, I'm with Kobe. But he has been a huge part of me going out every day, I always get at least 10,000 steps, because with him, I need to walk him. So those are all really important things that you can do. I'm just trying to read if I answered all your questions. I think so.
All right. Thank you so much. Any other questions from anyone? All right. Thank you. Shannon says, thank you. This session has been very informative, Myika.
Thank you, Shannon.
All right. Well, not seeing any more questions, I want to thank you all again for coming and joining us for this session, and being patient and staying a little bit longer than we anticipated, and being, great attendees in regards to technical issues as well. But now I want to really, really thank Myika for such a wonderful presentation. Thank you for sharing your story. Thank you for providing so much beneficial information in regards to social determinants of health. And we will all take this information and share it with others, right? And once again, you can see the recording of this session on the Sacramento Promise Zone Facebook page, also on the Sacramento Promise Zone YouTube channel. We encourage you to share it with friends, family, colleagues, and also stay tuned for the next session of the Mind, Body, and Spirit Health Series. It will take place next month, because we skipped a month. That will be on September 10th at same time, 9:30 a.m. And we have a really wonderful presenter who will be presenting on, I'll just say it layman's terms, she'll be presenting about the brain and the brain's functions. And you won't want to miss it. She is very interactive, and the promos will be out soon. So we'll get them out to you all as well.